Hello to all of you PEMFers. It is good to be here with you live on another Thursday Live. I'm Dr. Jerry Dreesen, the Executive Director here at the Association of PEMF Professionals, and I am happy to continue our series that we've got going on. We've been talking a little bit about clinical and veterinary applications of PEMF therapy. And so what I want to do is to dive into our part 2, and that'll be latest in research and tech. So I'll walk you through some of the new things that are going on. And I want to bring it, there we go, that's a better view. And we're going to be talking about some of the latest research, some of the updates that are there. And our organization, we like to go out and see what's new and then bring it over to our website, and I'll talk a little bit more about where you can view those. There are 4 of them that I'm going to be talking about today. We're going to be talking about assessing the effects of PEMF on painful diabetic distal symmetrical or symmetric peripheral neuropathies. We'll be talking about investigation of the efficiency of pulsed EMF on stretching exercise and experimental skeletal muscle injury model. We'll be talking about real-world treatment outcomes of transcranial pulsating PEMF as augmentation therapy for treatment-resistant depression. And then the effects of extremely low frequency, or ELF, fields on vital organs of adult rats with viability of mouse fibroblast cells. So strap in for some awesome science geeky stuff and try to change it back into English as we go through it. So let's start out with the first one, and assessing the effects of pulsed electromagnetic therapy on painful diabetic distal symmetric peripheral neuropathy, and it's a double-blind randomized control trial. So what's nice about that is you are taking away possibility of bias. So when you're having based on the type of therapy that's out there. So the worst therapy is I know you have the problem, you know you have the problem, here's something that we know is going to help, let's put it on you, and then record your results. So somebody already has the idea that something good can happen and that everybody knows who everybody is. And it was just done on a small group. So that's the worst kind of research. The best kind is where you have a large group. They don't know what's going on. The person that has the device don't know if it works or not. And then there's a test before, probably a test during, a test after, and then a follow-up test X amount of time afterwards. So that is kind of a double blind, means the person getting it doesn't know if it's real and the person delivering it doesn't know if it's real. So you can rule out placebo as best as possible. That being said, let's jump in. The summary of what's going on. So there was, what they found is that there was significant pain reduction with active PEMF therapy, and the group experienced a 30% pain reduction. And there was improved vascular health. So there was a trend toward enhanced skin perfusion pressure in the active group. So instead of it being like white and what's the word I'm trying to say? Wavy as far as the skin and stuff, there was like definitely some vascular increase going on, and it also decreased the pain. So summary is a double-blind randomized trial showed pulsed electromagnetic field therapy significantly reduced pain by 30% in diabetic peripheral neuropathy patients. That also suggested improved skin perfusion pressure, indicating potential vascular benefits, offering a non-pharmacological treatment option. So there you have it. Those of you that have friends, family that are diabetic, those of you that are in clinic that have diabetic patients, This has been a great research study that helps you bring that about. And again, those of you that have devices and you're looking to build a business, you can go to places that treat diabetic neuropathy and you can say, here's the research. Here's what I do. I can come into your clinic and do, once a week on your worst case scenario patients and see if we can't get these kind of results. And that being said, again, we're talking about amputees, people that even vets, amputee vets, or just, diabetic amputees. This should also help improve the outcome of the surgery too. So you can see some of the applications with that. Our next one we're going to talk about is the investigation of the efficiency of pulse electromagnetic field treatment and stretching exercise in experimental skeletal muscle injury model. Wow. Okay. And I've already had 2 cups of coffee, and I have no idea why my mouth is not working. So again, here is experiments in skeletal muscular injuries and stretching exercises using PEMF. And again, you can go on our website, find this and read the longer version, but what I want to do is just give the synopsis of it. So the PEMF Stretching Enhanced Muscle Injury Recovery article, it reduces inflammation and fibrosis. PEMF and stretching significantly lowered the TGF-beta-1 levels, which is limiting fibrosis. So fibrosis is where there's an irritation instead of being nice and smooth, and that there's a surface, fluid on there that becomes irritated and fibrotic, and then starts to adhere, and then it becomes glued together. Sometimes it even calcifies. So what's great about that is that it's showing that there's accelerated healing, and both treatments increase muscle regeneration and reduced inflammatory markers. So why not take this into a gym? Why not do this pre-exercise and post-exercise? Why not take this to a fibromyalgia talk or doctors and nurses that treat fibromyalgia? Why not reach out to places that sell fibromyalgia medicine and say, hey, how would you like to do a trial on your worst case patients? Again, each of these articles shows you the proof that they need to see. And they'll go, what is this PEMF and how does it work? Here's the article. And again, on our website, you can go to, let me back up here, where it says read more. You can click on that read more. And if there is a link to the actual article, you can click on that. And that's the article that was published. So you get it firsthand. In some places, you can download it for a fee, like $10. But if you could take that printed out and then have that in your binder, and then you can show that to the doctors that you want to work with or the clinics that you want to work with, that's all they really need to see is the actual proof. So that's what's great about these products. So the next one I want to get into is we're talking about real-world treatment outcomes of transcranial pulsating electromagnetic fields as augmentation therapy for treatment-resistant depression. And what's amazing about research articles is the length of the titles sometimes, but they're trying to get it all in, and that way it's possible to find it on a word search, but also to kind of include all the things that are going on. So as far as the background on this is it's all about treatment outcomes of patients who had received TPEMF as an augmented therapy in Denmark, and it was evaluated, and as far as the highlights that were going on. Maybe I just needed to drink some water out of my AOPP mug. That's probably what it is. So again, we have already gone through, brain activity and depression. And, again, shout out to Dr. Toy in Quebec for all his work with vets and depression. We've done lots of things. We've had people during some of our conventions talk about their brain injury and how PEMF has brought life back to them. There's a whole bunch of stuff going on with that. So the overall summary of this is that it boosts depression outcome or treatment outcomes. And this was with 8 weeks of PEMF, and it significantly lowered the scoring. So it's those of you that know about the HAM D17 scores, it's a series of questions and answers that people do to determine their level of depression. And the higher the numbers, the more depressed they are. So it lowers their scores, which is a way of mapping out the level of their depression. Early intervention advantages. So episodes for durations under 2 years were linked to higher response odds, possibly because the longer you have it, the more hardwired your brain becomes to the changes that are going on. And in summary, in real world study versus like a review of other research, 57 patients with treatment resistant depression. So they've tried everything else. They've tried medication, they've tried exercise, all of the things that you can think of to reduce depression. They received this treatment, reducing depressive symptoms and improving quality of life over 8 weeks. And then episodes under 2 years showed even better response despite study limitations like small sample size. So it was probably a smaller group, less than 57 on this. So again, just think of all of the things that we've talked about already. We talked about fibromyalgia. We've talked about muscle stretching. We've talked about vascularization in the distal extremities of fingers and toes. And here we've talked about depression. So it's just amazing things that can be going on with these devices that you already have. And it's just a matter of getting out there and letting people know that you have it and contacting the people that are using these or need to use these with people that they're treating. So again, huge door openers. You could just build your website around these 4 articles and talk about, all of the great things that you can help with. And not only is it a crossover from humans, but also over to animals, because we have very similar genetic makeup. So if you're having animals that are having, their extremity injuries, or you can tell that they've got some sort of lack of blood flow to certain areas, PEMF would be great for that. And then the last one we're going to be talking about is effects on extremely low frequency electromagnetic fields on vital organs of adult rats with fibroblast cells. So you've probably heard of ELF, PEMF, so that's extremely low frequency. So at the very, very minimum. And what kind of outcomes that they have? Well, I don't know. Did they have good or bad outcomes? I think you and I both know the outcome. So the mild biomechanical changes of the exposure slightly elevated the liver and kidney markers. So we know that they were being activated, but there was no structural damage. So histological analysis showed no tissue morphology changes. So some of you have talked about, can this be used on internal organs? And that's what this study was all about, was if you use PEMF on an organ or tissue, will it damage it? And they found no damage. So a study on the rats found the fibroblast cells that were exposed, they found a mild increase in biomechanical markers, but no significant cell proliferation or tissue morphology changes. So it did not increase the fibroblastic activity, which is good. And then, the marker ELF, extremely low frequency. So we're finding on the animal side good results. Now, the idea is to take that into human trials. And half the problem is, like with rats, again, you can, destroy the rats and then pick apart the insides and find out, how things look. You can do slides and things like that. On a human, you can't do that. You have to take tissue samples. And, who wants to volunteer to have a piece of their kidney removed so that can be looked at? So as we move over to clinical trials on humans, we'll actually see more of these as the ability to examine tissue in vivo, which means while they're alive, without damaging the human. As that ability happens, then we'll be able to get that too. And I see we have a shout out from Kathy. Oh, downtown Seattle. Welcome. We've got some blue sky going on. So yeah, you should have a really nice day out there. Hopefully you're down by the waterfront. So the summary again talks about what can happen. People that have kidney issues, that have pancreas issues, that have liver issues. Again, here is some great studies that are showing promise of being able to do that without causing issues. So to be able to go out there and tell people that you can help them with these things, we don't have enough of the research that says that it's okay, but we do know that on rats that it doesn't cause a problem. So again, the next step, of course, is jumping onto the human side. So I talked about our website. Where can we go to get these things? Well, on our website, if you jump over under education, you'll see that there's PEMF research. And you can click on that and you can see all of the research that we have on there for you to look at. However, if you're not a member, then you can preview two free research articles. So you can go through that and look at them. You are welcome to take a look at the ones I just showed you. And Melissa, hello, welcome to the show. And then also Patrick, hello from Ohio. Good to see you. And the thing is, when you hit if you've read your second article, then this thing pops up and it blocks you from seeing any more articles. But it talks about becoming a member. And it's pretty easy to do, especially if you are using PEMF and you want to know more about it. I recommend becoming part of our organization because you get access to all of these things as a member, including some other things too. With that, though, things that you can do, those of you that are members and people that are having issues, you can send them a link to this video. And if you know somebody, for example, that has diabetes and peripheral neuropathies, send them a link to today's broadcast where we talk about it, and they can see that PEMF is something that they can use. But you can share today's live. You can go over to LinkedIn, YouTube. We're broadcasting live over there as well. We talk about these things in our Instagram, on our blog. Spread the word. And the more people that that have these problems, that can get access to answers. Again, that's why we do these lives also, so we can present some really cool stuff. Those of you that are members, we can talk more about what we're talking about today over on the members side. You can just jump over there and ask your questions, and Lauren and myself will hop over there and answer to the best of our knowledge. If not, send you to somebody who's got the answer or the article. So who we are, what we're about. If you're watching this for the first time, who are these AOPP people? This is our code of ethics. We are a international organization that is designed to help people learn about PEMF and also become certified in using PEMF. So we learn all of the best practices so that when you are out there, if you're AOPP certified, people that see that, they know that you have received the best education on how to use the product that you have. If you have any questions about today, jump in, drop us a line, info@pemfprofessionals.com. Always happy to answer any questions that you have. And if you are interested in becoming a member, again, on our website, hop on there and look at all the different certifications that we have, and also becoming a member. Would love to have you jump on board and expand your brain on all of the possibilities of PEMF and how it can help you, how it can help your family, how it can help your animals. So with that, we will end today's broadcast. And again, I look forward to next week when we talk about our PEMF devices. So all of the different devices that are out there, we like to take an overall omni approach to what's out there and what's the difference between one versus the other. Not necessarily brands, but as far as like large versus small attachments, those kinds of things. So look forward to seeing you next week when we talk about that. And I am gonna jump on out of here and wish everybody a great day, and we'll see you again next week. So take care.